The following presentation will guide you through the features of the very latest in cutting-edge mobile health technology. Those who will benefit from this program include those who are uninsured, underinsured, employers, unions, and associations. Some key points. This program can be embedded into an employer's benefit plan handled by our TPA or can be offered as a voluntary plan. It will also meet the requirements and fit well within an employer's wellness budget, leaving our EAP and telemedicine benefits to provide to employees at absolutely no cost to the employer. The two main features underscoring each of our benefits are convenience and cost savings, offered in English and Spanish to both individuals and families, with the latter including all members living at the same address. The total annual cost in everything that you're about to see, and I emphasize the word everything, establishes a breakthrough in benefit costs. Unlimited access for a full year for the same cost as a single visit to a doctor. According to the American Medical Association, at least 70% of doctor visits and 40% of emergency room visits are unnecessary and could be resolved through a phone call with a health professional. With the average visit to a doctor's office costing $199 and the average outpatient hospital visit costing $1,275, our app could easily save thousands for the average family as it pays its annual premium with just one single call to a doctor. To drive home the value of telemedicine, a couple of brief examples. It's time to head off for work, but you're not feeling well. You can call in sick, spend the day traveling to the doctor's office, waiting in the waiting room, then have the doctor prescribe medication, pay the $199 for the visit, and head on home, keeping in mind you also lost a day's pay or one of your sick days. With 24-hour on-call doc, within an hour of feeling ill, you could have consulted with a doctor and had a prescription forwarded to a pharmacy that you could pick up on the way to work. Then there's the new mom who is woken up by her crying baby at 2 in the morning. The baby is running a high fever. The only option for medical advice is a trip to the emergency. With 24-hour on-call doc, within the hour, a doctor consults with the mom, confirming an ear infection. A prescription is sent to the local 24-hour pharmacy. Mom is saved from traveling with her sick baby to the hospital, spending stressful hours of waiting at a hospital, especially in a room filled with who knows what kind of germs, and she saved the $1,275 ER bill. Her baby ends up getting treated and is on the mend in a fraction of the time. And finally, imagine the benefit to a road warrior or a truck driver getting ill while on the road. One call will analyze the symptoms, and as you will soon learn, have our GPS pharmacy locator arrange for a prescription to be sent to the nearest pharmacy or a requisition sent to the nearest lab for immediate analysis. All, by the way, at substantial discounts. And here's our app's home screen, which provides direct links to our comprehensive nationwide team of health providers and direct access to our discount network of pharmacies and other health services. The Doctor Connect tab connects you to a nurse who will confirm your eligibility and verify that your health history is up to date. Members are required to complete a comprehensive medical history questionnaire prior to participating in a diagnostic consultation. The questionnaire, similar to the information provided during an initial physician visit, becomes a permanent part of the member's electronic medical record and is available to be updated by the member at any time. Prior to every diagnostic medical consultation, the automated system will ask the member if there are any changes or updates to the medical history on file. If not yet completed, the nurse will input your history over the phone. Our electronic health record system is a powerful HIPAA-compliant feature that centralizes and simplifies your healthcare management. The information submitted to each profile is secure and confidential, and is automatically filed as a permanent part of your electronic health record and is available to be updated at any time. In each and every one of your consultations, the doctor's notes, including diagnosis, treatments, and prescriptions, and follow-up discussions will be recorded and saved to our electronic health record online. This record can be shared with your primary care physician, ensuring proper documentation, transferability, and continuity of care. As you will note here, details are quite complete, as your health record will include a full summary, items concerning your lifestyle, any drug allergies, medications that you're taking, medical conditions, your surgical history, your family history, any medical images that you've uploaded, and all previous consultations. There are 3 types of calls that you can make to our fully credentialed and board-certified doctors. If you're calling to ask for general information from a physician, you will be immediately transferred to a doctor who will answer that question. If you're requesting a more detailed diagnostic or you've run out of your medication and need a temporary refill, a physician specifically licensed in your state will return your call within the hour, worst case within 3 hours. And should your situation require the doctor to observe the area of concern, the nurse will arrange for a video consultation. This next tab connects you to a registered nurse 24/7 should you have an urgent but non-emergency medical situation and need professional advice. Our eHealth Professionals tab is like an employee assistance plan, also known as an EAP plan, but this one's on steroids. This tab connects you to the portal that allows you to send questions to doctors, psychologists, pharmacists, dentists, dietitians, and fitness experts. We now serve up some of the deep health service discounts included in membership. Our discount imaging tab connects to a live agent who will arrange for your MRI, CT scan, or ultrasound at one of the 3,000 credentialed imaging providers nearest to you. By prepaying, our members receive discounts of 40 to 70% off usual and customary charges, and in this example, there's a real and substantial savings of $570. Our Discount Labs tab also connects you to a live agent who will book your lab request with the closest lab that's part of our network of over 5,900 industry-certified laboratories nationwide. And as you can see here, our lab discounts range up to 89% for our members when they prepay. One of the most cost savings benefits is not so new, but its delivery mechanism makes all the difference in the world. Let me explain. Here's an example of an RX discount card that's been around for a number of years, yet surprisingly is seldom used. Until now, these cards were delivered by email, in which you're required to print and then cut out the card and remember to take it with you to the pharmacy. The poor utilization has been attributed to statistics that show that we only open 13% of our emails. Of those 13% who open them, only a small percentage will print and cut out the card. Let's be generous and say 15% of the 13% cut it out, which works out to about 2% of the total. And then how many of the 2% remember to place it in their wallets and use it at the pharmacy? You can be assured that it's well under 1% of those who receive that email. With our RX discount card, as long as you have your mobile with you, you have your card. With up to 70% discounts off generic and brand name medications, our card is accepted at more than 60,000 pharmacies, including all of the major chains. Now that we've placed the RX card in our mobile app, we've naturally taken advantage of current GPS technology to help locate the closest in-network pharmacies. We provided for entering your local address or zip code, or you can take advantage of your mobile's GPS functionality. We've also included the pharmacy's phone number to directly connect, and both driving directions as well as a map. The index key at the top of our screen opens up a further selection of benefits. The first is our Wellness tab, which connects you to our mobile-friendly website, which provides access to our interactive wellness tools. These include our symptom checker, a full list of health topics, and our interactive tools. Our Health Manager provides health assessments and a personalized health risk manager, and up-to-date info on health news as well as many topical videos and articles. Our online fitness center includes very comprehensive sections on building personal exercise routines using how-to videos for each exercise, an exceptional nutrition center, and a weight management program backed by health professionals. Also included in our comprehensive wellness section are meal plans with a selection of graphs to analyze your progress. Included in our last few tabs is the Programs tab, which can link back to your own mobile-friendly website to offer your other products or services. a customizable handbook tab that can access corporate or association-related information. And an insurance quote tab is available for insurance organizations should they want to offer their insurance products. This tab serves up a request for quotation which is submitted back to the organization for follow-through or can be connected to a quote engine. And probably our most powerful feature for increasing your customer's lifetime value or member continuity allows our private branded clients to instantly communicate with their customers, employees, or members using our push technology or texting. Using our client dashboard, you now have the ability to instantly communicate locally, regionally, or nationally with those who have downloaded your mobile app. When you consider that 98% of text messages are opened within 3 minutes, there's no better method to connect with your audience. And for marketing organizations at no further marketing cost to you, your appreciative customers will drive new prospects by clicking on Tell a Friend. Through this app, Tell a Friend provides for communicating through most social media channels. Now, any message or promotion that you send out to your customers will now be received by these new prospects. And to simplify enrollment for these prospects and your voluntary customers, we provide you with an enrollment site. Whether an agent does the enrolling or they send their client to this site, tracking is guaranteed as orders are not processed without an agent ID, and to be certain the right ID has been entered, a confirmation is required. As we come to the end of this presentation, I'd like to point out that we're not alone in presenting a telemedicine solution. We're joined by some very prominent individuals and corporations. Starting with Dr. Phil, TV's #1 talk show host, who recently launched Doctor on Demand. Their program costs a consumer $40 for each 15-minute call to the doctor. That's 15 minutes. $80 for a 30-minute call. Quite expensive for a telemedicine service. Yet, there is no requirement for the doctor to review the caller's full medical history, as they only ask for the caller's current symptoms and then their allergies. Further endorsing telemedicine are the insurance carriers who are including telemedicine as a benefit so as to decrease claims and their associated costs. It's apparent that these carriers are capitalizing on the savings derived from using telemedicine originally developed for the consumer. Leading carriers include Blue Cross Blue Shield, United Healthcare, and Humana, with Cigna offering the MD Live telehealth service. What's interesting is that they charge the same prices as we do, $14.95 per month for an individual plan, and $19.95 a month, but that's for a couple, where our $19.95 compares to their $24.95 for a family. But on top of their monthly fee, they further charge $20 for each doctor's consultation. In comparison to Dr. Phil's Doctor on Demand or Cigna's MD Live, which are two of the most advanced products on the market, our mobile app comes with all of the same benefits, plus the ability to communicate with a more complete lineup of health professionals, plus you get our built-in discount pharmacy card, plus our powerful selection of wellness benefits, a section for an employee or association handbook, a quote engine connection, and finally the ability to securely and instantly communicate with your users. And our all-inclusive price doesn't change. So there you have it. The timing couldn't be more opportune to make a difference for millions of Americans. Especially with Obamacare falling way short of its goals, and because Obamacare requires uniform coverage by insurers, it's created an even bigger challenge, with insurance companies having to increase premiums to cover those who used to be uninsurable. And finally, to exasperate the enormity of this problem, healthcare costs continue to rise due to higher prices for medical services and a rapidly aging population. Timing is ripe for a low-cost solution to cut healthcare costs utilizing today's cutting-edge technology. Such a solution is our 24-hour on-call doc mobile application. What you've just seen is only our phase one as we continue to work on developing the future in mobile health technology, which will be available as add-ons exclusively through our approved distribution network. Thank you for your interest and for watching this presentation.